Hello, and congratulations on beginning your Invisalign treatment. In this video, we will review everything you need to know to ensure a successful smile journey. First, it's important that you wear your aligners consistently for 20 to 22 hours a day throughout the entire treatment. You may take them out to eat or drink anything other than water to avoid staining or damaging your teeth. You also may be wondering what the little bumps on your teeth are. We call these attachments. Attachments are used to not only keep your tray in place, but to move your teeth where they need to go. It is normal for your attachments to feel uncomfortable at first, but they'll feel better as time goes by. Attachments are removed once your treatment is completed. To put your aligners on, use your finger to push down on each tooth until they are firmly seated. Please avoid biting your aligners. If they're not fully seated, they may break. Use the provided rubber sticks or chewies to apply pressure and seat the aligners even more. Using chewies for 10 minutes a day is very helpful and will improve your treatment results. To remove your aligners, use your index finger to pull the aligners from behind the very last molar. As the side comes off, grab the aligner and peel it away from your teeth in a circular motion. At the beginning of the treatment, and with each new set of aligners, you may be experiencing soreness or discomfort in your teeth. Don't worry though, because this discomfort will go away in a few days. You may take over-the-counter pain relievers if necessary. Your aligners come in separate bags that are all numbered. It is best to keep each set of aligners in the respective bag to avoid mixing them up. The number of the aligner that you're wearing is also printed on the aligner itself, in case you're not sure. Each set of aligners must be worn for 7 to 14 days depending on your treatment plan. Please stick to the schedule recommended by our doctors to ensure successful results. Using the Invisalign app on your phone is the best way to stay on schedule and remember when to switch your aligners. It is best to switch to new aligners before you go to sleep so you can get several hours of continuous wear. Before switching to a new set of aligners, please take a close look in the mirror to make sure that they are fitting perfectly on your teeth. If you notice any gapping between the aligner and one or more of your teeth, try wearing the aligner for a few more days and using chewies more often. Aligners should also feel loose for at least a couple of days before switching. Be sure to keep your aligners in a case when you're not wearing them. This will prevent them from getting lost or damaged. Many patients make the mistake of placing their aligners in a napkin while eating and accidentally throwing them away. Also, please keep your aligners away from your pets, especially dogs. If you lose any of your aligners, please contact our office so we can advise you how to proceed. When it comes to cleaning your aligners, you may use the Invisalign cleaning crystals provided, retainer cleaning tablets, or clear mouthwash. Rinse thoroughly and use a soft toothbrush afterwards. Please avoid using hot water as it may damage your aligners. Make sure to clean or rinse your aligners every single time you remove them. If you don't have a toothbrush with you, make sure to rinse the aligners before putting them back in and after eating. It is important to brush your teeth or at least rinse out your mouth before inserting your trays again. Follow these simple guidelines and we will guarantee you a seamless process to a beautiful smile. Thanks for watching.